How often should PERQUE Potent C Guard be dosed to maintain an elevated serum level?
Yes, so it's a very important question. You want to have enough ascorbate, enough vitamin C ascorbate, the fully buffered, fully reduced L ascorbate that PERQUE provides. You want to have that based on your C cleanse. That's what tells us on a weekly basis how much oxidative burden we have and how much antioxidant control or how much antioxidant protection we need. And I can tell you what the ideal plasma or blood level of ascorbate is, but I can also just mention that it's really hard to get an accurate plasma or blood ascorbate level. You have to harvest the cell and spin it immediately and freeze it right away and make sure it stays that way until the lab gets it, and then the lab has to do a very elegant analysis. So the bottom line is use physiology and rest assured that you're doing what the body needs. As long as on a regular basis you do a C cleanse and take in 1/2 to 3/4 of that amount spread through the day on a daily basis until your next C cleanse, because ascorbate protects the membrane, the cytoplasm, the battery, the whole cellular machinery is enabled by the maternal antioxidant ascorbate, only the L ascorbate, not the synthetic D or DL. When you see vitamin C or ascorbic acid on a label, that's synthetic until proven otherwise. And we only use the natural form, the L-ascorbate, fully buffered and fully reduced, because that's what nature prefers. Nature preserves that inside the foods that we eat, and nature uses the L-ascorbate and does not use the D-ascorbate. So the D form of ascorbate, the D form of vitamin C, can build up and irritate the intestines and should not be used, at least not in our recommended, if you follow our recommendations. So you want the L-ascorbate, you want it based on the C cleanse, you want it sufficient that your plasma level will be 3 to 5 milligrams per deciliter based on your oral intake. Now by vein you can get higher levels, but orally what you would like is 3 to 5 milligrams per deciliter of plasma ascorbate. And then remember that the metabolically active cells, the hormonally active cells, the nerve cells, the immune defense and repair cells, they all concentrate ascorbate 30-fold over the plasma. So the difference between 1 and 2 in the plasma is a difference between 30 and 60 units inside those metabolically active cells that use and need a lot of ascorbate. So we know what the ideal level in the blood is, 3 to 5 milligrams per deciliter. It's very unusual for clinicians to measure it because it's so cumbersome, and the labs are fastidious about not measuring it wrongly, not measuring it badly. And so what we do is recommend things that are physiologic, like the weekly C cleanse, to give you guidance so that you don't need to spend a lot of time and money and maybe even frustration in trying to get a quote accurate plasma ascorbate level. But for those who are researchers are interested, 3 to 5 milligrams per deciliter in the plasma, and recognize that the metabolically active cells concentrate ascorbate 30-fold over the blood level, all the way up to 5 millimolar, which turns out to be a very high level in biology. And what it shows is how much the body likes ascorbate. That is, it doesn't have a typical rapid uptake and then saturation phase. In fact, it continues to take the ascorbate out. As long as it's in the blood, it'll be concentrated 30-fold in these metabolically active cells, all the way up to the physical saturation of ascorbate in the cell. So safer, more effective, fully buffered, fully reduced L-ascorbate, we recommend.